So we have the term bioavailability. So what do you mean by bioavailability? So bioavailability simply means it's the fraction of the drug that reaches the bloodstream after you give a specific dose of the drug. So in case of parenteral route, you have 100% bioavailability. Why? Because the fraction of drug that reaches the blood is directly injected into the blood. So that's why parenteral route or in injectable route you have 100% bioavailability. All the drug is directly inserted into the blood. So in case of oral route, remember the bioavailability will be less. It will be variable, but it will always be less than parenteral route, that is injectable route. This is because when you take the drug by means of mouth, it is absorbed from the stomach into the blood, then it usually goes to the liver. In the liver, metabolism of the drug occur, and then the drug reaches the bloodstream. So the actual quantity of drug that reaches the bloodstream after metabolism in the liver is low. Therefore oral route gives low bioavailability. So then we proceed toward another important term, that is bioequivalent. What do you mean by bioequivalent? Remember, if two formulations of the same drug produce equivalent bioavailability, these drugs are referred to be as bioequivalent. So what do you mean? This simply means two formulations. For example, one is the tablet form of the drug, other is the liquid form of the drug. You take one Panadol liquid and one Panadol solid form of the drug, and both these drugs you took the equal dose, and both of them are absorbed into the blood equally, means equal concentration of both of these formulations is obtained in the blood. So both drugs will be called bioequivalent. And if the two formulations of the drug differ in their bioavailability, you took a tablet form of the drug and liquid form of the drug, equal dose you took 100 mg, but the net absorption into the blood was different, so such drugs will be known as bioinequivalent. Then we have factors affecting bioavailability. So what are the factors which affect bioavailability? So all the factors which affect the drug absorption will affect the bioavailability. These include physiochemical properties of the drug. For example, physiochemical properties of the drug mean if the drug is, for example, lipid soluble, it will be absorbed better than the non-lipid soluble drug from the gastrointestinal tract or stomach. Moreover, liquid formulations are usually better absorbed than the solid form, for example, tablets. So these factors of the drug will affect the absorption, and hence they will affect the bioavailability, that is the effective drug concentration into the bloodstream. Then we have other factors, for example, routes of a drug administration. So as this already we discussed, parenteral route or IV route will have a greater bioavailability than the oral route, because we said that in oral route, because of the liver metabolism, drug concentration reaching the bloodstream is low. Then we have other factors, like for example the presence of food particles in the stomach. If there is food available, so the net absorption of the drug will be low. If there are concomitant availability of other drugs can interfere and prevent the absorption of a certain other drugs. And remember, absorption surface area is also determining the absorption. And if there is gastrointestinal disease, infections and diarrhea, for example, so in those cases your absorption of the drug will decrease, and hence bioavailability will also decrease. Then so these were some factors which affect the bioavailability. Other factors include first pass metabolism. So what do you mean by first pass metabolism? To understand first pass metabolism, you need to know that the normal pathway from the oral route. So normally what happens, the drug taken by the mouth, oral route, will go into the stomach. From the stomach it is absorbed and it goes into the liver. In the liver, metabolism of the drug occur, and then the drug reaches the bloodstream. So the actual quantity of drug that reaches the bloodstream is low through the oral route, and this is because of first pass metabolism in the liver. Now you can see in the figure, in the first step the drug is taken by the mouth, reaches the stomach. Then in the second step the drug is absorbed from the stomach into the liver, and then in the liver metabolism of the drug occur, and finally the quantity of drug reaches the bloodstream, which is low because of first pass metabolism. So what are some of the consequences of the first pass metabolism? And so remember, there are some drugs which are highly metabolized by the liver, which undergo extensive first pass metabolism. So it is important we don't give such drugs through the oral route. Such drugs are then given through the parenteral route. For example, an example is lignocaine. So lignocaine, if given through the oral route, will be metabolized, and not good concentration will reach the bloodstream. So we give such drugs, for example lignocaine, by means of IV directly to treat, for example, ventricular arrhythmia. So that is one of the consequences of first pass metabolism. Another consequence is that the dose of drug required for the oral route should be increased. Okay, so you can also increase the dose of drug from the oral route to achieve effective blood concentration or increase bioavailability. For example, nitroglycerin, if taken by mouth, sublingual nitroglycerin usually placed beneath the tongue, the dose should be high in the oral route because of the first pass metabolism. So then we have uh, other concepts like hepatic diseases. So what does hepatic disease cause? Remember, if there is a liver disease, so proper metabolism of the drug will not occur, and if metabolism of the drug is decreased, what happen? First pass metabolism decrease, so bioavailability of the drug will increase. Okay, so when there is decrease in drug metabolism, bioavailability of the drug which reaches the bloodstream will increase, and hence, for example, propranolol, lignocaine, the drugs which normally undergo first pass metabolism, there, if a person is taking propranolol, for example a beta blocker or lignocaine, so their concentration can increase in the bloodstream in presence of hepatic disease, because normally they undergo metabolism in the liver, but if there is liver disease, so proper metabolism will not occur, and hence the concentration of these drug can rise above the normal range,